few different things and a few different streams of thoughts that I know is going to come up. So for example, the various benefits of parks and open spaces, getting real about the consistent issues that we have in low-income and communities of color when spaces are not intentionally planned to keep people in place, when spaces are not intentionally planned to keep communities whole, and when we're really not planning for prosperity as well. How we make sure that as we green our cities over time, especially in response to climate change and environmental issues, that we're doing it with the perspective of justice. And so having those as a part of our conversations throughout the day. And then any, something that I know that Odetta talks about a lot for Atlanta is issues around how we experience open spaces based on culture, ethnicity, race, income, how we might feel in spaces that are over-policed, how we might feel safe or not, how we might feel free to express ourselves or not, and how we have access to increased open spaces as well. And then what are the solutions that people are really working on? How are people focused on addressing displacement and gentrification around these spaces while continuing to try to promote them as well? And so we are really excited around the different solutions that everybody around the communities are working on in all of the different SPARCC regions. And so with that, I would say thank you to Odetta, thank you to Atlanta and all of the work that you all are doing here. And for the team, I'm gonna be the facilitator mostly to guide through the portion of the agenda to help keep us moving. Maria is gonna be the online facilitator. Nick is the one that if something breaks, hopefully he can fix it. And then just thank you to everybody in the team for helping us to push in this way so that we can really get moving on this issue for not just parks, for the sake of park, but really the ecosystem of community, this is an essential conversation. So thank you, Odetta. Oh, I think you need this.
Oh, yes, thank you. So it's my pleasure, while we're bringing the mic back down, to introduce sort of our keynote speaker for this event, Dr. Hanaa Hamdi, who is the Director of Health Impact Investment Strategies and Partnerships for New Jersey Community Capital. This is a new position for her, but she has more than 2 decades of experience in public health administration, research and community development, and she is my good friend. So it is with great excitement that I turn the floor over to Hanaa.
Well, first of all, I am thrilled to be here for so many reasons, and I'll get into that in a little bit because it's about parks. But I'm honored to be a speaker, but also to learn and hear amongst all of you who've been doing sort of this amazing work across different communities. About 3 years ago, I think I was at the launch in New York at the somewhere in Harlem, I can't remember. Schaumburg, right? And I remember when, the conversations that have ensued, I was like, okay, so housing and transportation, great. What about parks, open space, right? And so they're like, oh, we haven't thought about that yet. I was like, okay, I'll see you guys in 5 years, right? But it hasn't been 5 years, half of that, and this conversation is happening. And so today, I actually read some of the questions that you all thought about and crafted so that we can have a discussion. And so I can talk about parks 15 hours a day, right? The positives and not so positives, but I'm not going to bore you with that. But what I would like to do is actually talk about how do we create or develop and design parks that do not accelerate displacement? I think that's the core of this conversation, right? And so I will get to that, but to the point that I made that, it was about housing and transportation, and later it became parks. How about we situate park development in a broader context, right? How about we talk about community health? Because that is essentially what we're trying to develop. And so then, if we're talking about, community health, who are we developing parks for? People, right? And if we're talking about parks and people, let's talk about the historical context and how people experience parks, right? But I'm going to do a little bit of contextualization about how to frame this so that as SPARCC evolves and transforms, that there's a bigger framework, that we can talk about. So housing, transportation, parks, and eventually we want to talk about water. We want to talk about climate change. We want to talk about food. And that's how you create healthy, thriving communities, right? And so rather than talking about single issue equities or single equity narratives or health equity, housing equity, park equity, how about we talk about equity as a whole? So to begin, I like to start by saying that health is an outcome, right? And we become healthy when we live in communities that, that offer a network of supportive environments and networks that are simultaneously working in concert towards equity, right? And what does that mean? That means that you can't have health or a linear relationship to health because you have housing, when in fact you need housing, you need food, you need multimodal transportation, you need healthy water, you need clean water, you need healthy homes, right? And so historically, how we got to this place is because communities of color have been planned and zoned, right? And so to undo this, we talk about, oh, these communities need housing. So it becomes an equity of housing issue. Or these communities need transportation, so it becomes a single issue of transportation, rather than, planning for whole communities. And so if we look at healthy communities and how we plan for healthy communities, then the priority should come from the people, right? Earlier, when Odetta was asking, imagine your healthy place, I was actually going to mention, so my happy place is always in a park, right? And this particular park is a small park in South Ward of Newark, New Jersey, and is one of the first parks that I actually designed. And my role was only as a designer, as an architect, and not so much as a community advocate or as a researcher or as a developer. What's amazing about this small park, and it's less than a quarter of a mile, is that it came because people got sick and tired of finding dead bodies in that park, right? That park is beautifully and tightly nested in a residential community. The community organized a partnership across different sectors: hospitals, higher education, and other anchor institutions within Newark, but then also within a larger region, Essex County, and developed a strategic plan. And that plan was that they want this park, but around the park that they want affordable housing, they want new businesses, employment opportunities, they want clean water, they want to be able for the children to walk to the park safely, and they don't want the housing around the park to create displacement. And this is about 20 years ago. And to be honest, I didn't know what displacement meant. And I was like, okay. And so in addition to the built environment that they were asking in the strategic planning with affordable housing, active transportation, and walkability policies, they started also asking for investment and how to keep this park locally owned for the communities that planned it. And their foresight into the future. And these are communities that often are not invited to the table to talk about planning. But they knew that if there was private funding that invested into this park, then the property tax around that park will change. The demographic around that park will change. And so the strategic plan that they developed would be implemented, but they wouldn't live there long enough to enjoy it. This community group was made up of the Mildred Helm Resurrection Committee, and it was Deacon Crawford, an elderly woman who lived in Newark, in South Ward of Newark for 73 years, and a local park stewardship group, United Parks is one. Once they developed the strategic planning, in 2008 came around, 80% of the housing around the park went into foreclosure. And so crime came about, And the plan that they put in place disrupted that, was disrupted by the foreclosure, and it was high crimes. And around the time there was a change of leadership. Senator Cory Booker was then the mayor of Newark, New Jersey. And they reached out to the mayor, and they basically threatened that his re-election depended on exercising, that strategic plan. And they're very politically astute, and they were able to work with the director of Park and Recreation to allocate some funding for that particular park. And the strategic plan became the city's strategic plan eventually. And remember, this is a small park, less than a quarter of a mile, right? However, because the city understanding of parks is for recreation, the allocation of budget wasn't sufficient enough to accomplish what the community wanted, right? They wanted affordable housing. They wanted the food systems changed around the community. They wanted a different type of schools, around within the proximity of the school. The city and everyone that that was around the table to as a partner for this park viewed park as a space for recreation only, right? And so today my conversation with you is, how do we develop and design parks? Well, actually that's your question, in the way that it doesn't displace people. So the conversation that I would like to, that actually I want it to be a discussion, is that for one, we have to reorient the way that we think of open spaces, right? Recreation is great, but today, parks offer a lot more than just a recreation space. They actually have functional utility, right? There is a randomized study that show that greening open spaces, creating parks that are well programmed and designed through culturally nuanced culture, could actually decrease crime and community violence, right? That parks can serve as opportunities to create jobs and businesses. Additionally, if we program parks in a way that speaks to the community, it changes the social, sort of interaction. So the benefit of parks, in brief, is that you can have from individual health benefit to community health benefit. At the individual level, there's data that supports that being in the outdoors, particularly for children, for just only 2 hours is equivalent of treating a child of Ritalin for 72 hours. 2 hours a day versus 72 hours of treatment with Ritalin. Mm-hmm. Moving a little bit across the human development spectrum, we know that if seniors are outdoors, we're decreasing isolation and suicide, which is currently among one of the rising incidents and a public health crisis, right? At the community level, we know that using parks as opportunities to spark business and economic development can address food insecurity. It could address unemployment. And so then, how do you create an interest from different partners across the community without the displacement factor? One of the things that the United Parks is One, or Mildred Helms, Mildred Helms Resurrection Committee developed, is sort of this interest around anchor institutions, right? Anchor institutions are hospitals and higher educations, or institutions that have vested interest to make it for community development. Their investment doesn't create new development, but it does strengthen the community fabric. For example, in the Mildred Helms Park, Barnabas Health System invested in affordable housing as well as supportive housing for their patients. Rutgers School of Business invested in developing a community farm that trained 35 farmers, urban farmers, and then that farmer produces about 8 tons of fresh produce, and it's selling to high-end restaurants in New York. Right? In addition to creating the business model, the Rutgers Business School also trained some of the preschool parents, 93 preschool parents, to use the park as opportunities for jobs and training opportunities for parents who were otherwise unemployed. I think one of the most amazing outcomes that came out of that small park and the farming opportunity is that the farm actually feeds 93 preschools in Newark to this day, right? And what that has created is the funding from the USDA to the schools no longer funds packaged foods. So the money that goes into packaged foods actually goes to expand the feeding program into the schools. So that small park created an opportunity for redevelopment for housing, for supportive housing for patients of the hospital, but then also affordable housing for the community. That small park was an opportunity to create urban farm. And gardens are great, but this is an urban farm that has viable economic opportunity for the community. It trained parents from the preschool, but most importantly, provided nutritious food for over 2,000 preschool children who were otherwise eating about a third of their total caloric intake before noon. But replacing that with fresh produce changed the outcome of what they eat, right? So there are policies, implications, and opportunities here, but if a small park is able to develop, and to spur economic development in such, from a small community, imagine what large parks can do, right? So I want to leave that here. Let me see how much time I have, and then I can continue.
Maria, how are we doing on time? 5 minutes.
5 minutes. I have the other thing that we don't often talk about is, and I saw this in some of the questions, is that green gentrification seems to be something that people always refer to. Every time I'm in a conference and I talk about developing a park, and the one thing that people will say, well, the first question that, well, what about green gentrifications? Park in and themselves do not displace people, right? However, bad policies and racist planning history is what causes people to be displaced, right? And so I started by saying that if we're going to change development of parks in the way that it really lifts and builds community, then we have to reorient how we do this. I think in one of the reports, I think it was Denver, they have this thing called natural narratives. What that does is it moves away from traditional planning policy, in the way that it really focuses on people and it prioritizes parks within the community. It prioritizes within the community's needs, right? So it's not just parks, but in addition to parks, what else can go in this place, right? And if you plan parks for people, then the history of people should also be prioritized. With respect to planning and parks, that history has not been good for people of color. In fact, historically, one of the best parks that I can think of, and that's one of my happy places outside of the Mildred Helms Park, is Central Park in New York City, right? And so that displays the African American village, right? And the High Line did the same recently. And we can say the same thing about the 606. And so there is history. And so green gentrification is a real issue. But the issue isn't the space itself, but how we plan for that space and who's planning for that space. Right. I just lost my thought. So that was the history. And in the context of community health, if we begin to think of parks, they have an opportunity for recreation, and the recreation is important for health outcomes and physical activity that's needed. But if we think about parks in a more expanded way, sort of to have a function beyond, sort of recreation, the one element that we need to think about critically now is climate change and parks, right? And I keep saying parks, right? But it's not just parks. It's parks and open spaces, and green schoolyards, and linear parks, and greenways. These green spaces are key opportunities to address climate change. So if we're framing parks within this larger context of community health, another issue that comes up, and I'm surprised I actually didn't see it in the list of questions, is the whole issue of parkland alienation, right? So when cities actually run out of, development space, and I think we'll get there, there is evidence, and I see this in New York quite a bit, that cities sell parkland for development. And either they can privatize that park, or they sell that park for private development. That's also a concern that I would like to raise, right? The park is not just developing parks, but also using land that's been identified for parks for greening that could be lost to development. I'll stop here.
Thank you, Hanaa. So what we're gonna do is really discuss what you talked about, and how we're gonna do it.
Can we move the mic to Sasha, please?
You might have to move.
Yeah, I'll go. So what we're gonna do is pick up on the themes that Hanaa just spoke about, but we're gonna talk about it in the rooms first, and then we're gonna come back into the collective main virtual space for us all to talk together. So we'll have about 10 minutes in each room. And I think the two things are like what really resonated with people, and how to really kind of move those things forward.
Hopefully you had some good conversations there. It looked like it. And I see we have many questions that folks have typed into our Google Doc. Just to let you all know, we will have a time to get through a few of these. We will share your questions with Hanaa, and as part of our follow-up to today's event, we will get back to you with her thoughts on those questions that we haven't had a chance to get to. So I'm going to give Atlanta an opportunity if you there in the room want to ask her a question, and then we will dig into some of these other questions that folks have written in from other places. So Atlanta, do you have a question there in the room for Hanaa?
Yeah, and just also just a reminder too, we're going to have time to talk in the room. So hopefully there'll also be, because 10 minutes was clearly not enough for us to get into some of the stuff Hanaa brought up for everybody. So of the comments that we were able to gather in that brief time, we got an interesting point about anchor institutions, the point Hanaa was making about anchor institutions. And so how are some of the ways, really some of the strategies that anchor institutions can be used to help use the park as an anchor for the legacy resident, sort of take it from that theoretical town gown thing down to what are some things that help people stay there in the role that anchor institutions play?
Absolutely. That's actually a great question. So by definition, green institutions, anchor institutions are institutions that have vested interest in community building and development, right? And so hospitals, higher education are examples of anchor institutions. One example of an anchor institution of how hospitals can invest in community building, particularly nonprofit hospitals. Over the last 3 months in my current role, we're working across 46 hospitals in New Jersey and about 50 other hospitals within the region to look at how hospitals could actually invest in the way that's meaningful to them, right? To address some of the issues, so the issues of rehospitalization, to decrease rehospitalization of patients, and decrease the utilization of emergency room, because these are really costly, right? For example, there is one hospital system in New Jersey that the gross revenue is about $68 billion every 3 years. It's a nice chunk of change. But every year, they're spending close to $18 billion in rehospitalizations across the region, right? And so then through a strategic plan and partnerships, if you can get a hospital to invest that 5% that they're required to invest into community benefit into something that has a return on investment, return on value, that, you know, that can address some of these issues, that's an example of how you can actually get an anchor institution to invest into the community in a way that doesn't really displace it, right? So there's this win-win, you know, model here. I'll give you an example. I said outside of New Jersey. In Washington State, a statewide hospital invested in a development of a park. The park was able to address some of the chronic diseases, right, by programming the park in a way that has clinical implications. They hired about 35 community health workers, and those community health workers were liaisons between the clinic and the park. They looked at the frequent flyers of the emergency room, and then also the patient population that was being discharged from a hospital within 7 days and then returning again. So that cost, those two populations, was costing the hospital $23 million a year. The park only cost $1.7 million for development, and then additional $500 for training the community health worker. That's less than 2% of what the hospital earns in a year, right? But it addresses some other major costs in terms of diabetic patients. So that's one way that you could structure a partnership with an anchor institution. Does that address your question?
Thanks, Hanaa. Following up on that, there is a question that we have here as well that's sort of for Pittsburgh, kind of asking the question too of how do we see parks themselves as anchor institutions? So how do we think about that? And I'm going to kind of merge this with what I think is a question coming from Chicago about a lot of times the discussions around parks are sort of seeing this return on investment or this revenue programming piece. Like, how do we think about parks as an anchor institution itself and really thinking about the health benefits of it versus just kind of a revenue generating question? So hopefully, Chicago, I've captured that question for you, kind of merging the two questions we had about continuing this notion of anchor institutions and then seeing the value of parks and partnering with public health organizations to see a park as part of an essential building block of a healthy community versus just kind of a revenue generating idea.
So I guess it's for us of how we conceptualize parks, right? For as long as we look at parks as recreation spaces, they're the spaces that get the least allocated, budget from municipal or counties, right? So we have to reorient our thinking of how we think of parks. If there is a function to a park, for example, that if there is a city that has a high crime and community violence, the greening and programming of that park can serve as intervention. So that's a function, right? There's a report that comes out of the National League of Cities every year of how mayors across the country prioritize the different agencies or different issues, right? And so I've been looking at that report for the last 5 years. And if you look at the average of mayors that prioritize parks, it's actually less than 50 of those mayors. So if there is a priority for mayors that comes up, it's economic and housing development. That always ranks first. And then number 2 is decreasing violence and increasing public safety, right? Health as a whole always ranks less, like on the bottom, unless addressing public health emergency management, right? If there's Ebola, guess what? The municipality is going to put significant amount of money to manage that, that public health issue. However, we don't think of parks as opportunities to anchor communities or to create a value beyond recreation. So number one is that how do we justify the development of parks and the programming? And so I actually intentionally didn't go into the programming of parks, because oftentimes we think of sort of programming of parks rather than developing parks. We need to change the infrastructure of communities so that communities could actually exercise or go out to, to use parks. There's a sort of this tension in the park community between, do you build parks or do you program parks for disease? So for example, the prescription programs, I think they're great, but as long as they're balanced with other programming, right? So when you prescribe a park, there is this sort of philosophy that everyone in that park is ill, right? Mm-hmm. And that takes away from this idea that parks actually inherently an environmental justice, mm-hmm. or even a human justice, and I would take it that far. Like, given our climate crises now, we have to start thinking of green spaces differently. Mm-hmm. And so once we reorientate that understanding or how we perceive it, there's an opportunity of how others will invest into it. So how do we prioritize it and take it from just recreation to something that all cities need to address violence, to create tourism, right? And along with tourism is sort of this whole experiential economy that comes with that, right? Programming parks, not just for the sick people, mm-hmm. but also for culture, mm-hmm. right? For attraction. So those are some of the ways that you could actually shift this whole thinking about, green spaces. The other is we often think of green spaces relegated to just parks, but how about we think about expanding our idea of nature and green spaces? Every community has schools, right? Every community has preschools. And having green schoolyards is also an opportunity to anchor, parks or green opportunities for communities, right? Those are already built in spaces that you can design to have a green effect.
Thanks, Hanaa. That was a super response. And ties into, we have a few different regions who've asked kind of a similar question around how do we better engage the community into the planning and the programming for parks, and thinking a little bit more of that in the context of, we know that in many of these communities there's a history of racist policies, and there are institutional structures that have really kind of maintained the white privilege and the white power in terms of thinking about parks and planning for parks and who parks are traditionally thought of as being for. So a number of the different regions have kind of asked this question about how do we tackle some of those historical policies, and not just in thinking about parks, but in the planning process, and really do a better job of getting the community to the table to ensure that parks serve them holistically. So I think you started to talk about that a little bit, even with just thinking about schools, but we'd love to hear more from you on that. Big question there.
That's a good question. I would begin by how we even frame that, inviting people to the table. Mm-hmm. Inviting people to the table doesn't necessarily mean that the community has a voice and that voice is respected and that it has a say, right? That's number one. I think we need to begin by actually trusting that the community knows what it wants. Oftentimes we think of, we say that the community doesn't trust us. I don't know who us is or who we are, but let's trust that the community knows what it wants, right? And so in the example that I gave of Mildred Helms Park, we didn't get to that strategic plan and community engagement over a week or a month. That took 12 to 15 months. It was reiterative of going into the community and asking, how do you like to see this park developed, right? What else do you want to see other than a park? Of course, you're going to get the 1/3 of, sort of the complaining of violence, and that's real, right? People are going to talk about sort of the immediate issues. They're going to talk about poverty. They're going to talk about food insecurity. They're going to talk about violence, and those are issues that you can address through the park. But that's not a deterrent to say that the community doesn't want a park. Once those issues are heard and put into the plan, then the community will come to this point, well, this is actually how we like to develop the park and design it. What we've done historically is sort of reverse, right? We've asked the community that we think the data shows that you need a park here. We want you to come and choose the colors, right? That means that you've already decided that that the park is planned and designed and that you just want the input and color. And so the distrust is inherently how we're thinking about how to engage communities, right? So it's not building a park for people, it's bringing the community to build a park for itself, but along the park, what else do we need, right? How should we program the park, right? And so I think if it's always thinking about how do we build for people. If we're building the parks for people, then let the people speak for, for themselves and then their priorities. I think that gets to the heart of that answer.
That's great.